Okay, so we are live with this week's episode of Startup Weekly. This week I am joined by Rick Lindquist, who is the founder of LegUp Health, a free health insurance agency that helps find, use, and manage your own coverage. So Rick, thanks very much for joining this week. You're very welcome.
Thanks, Gordon.
Awesome. It's great to have you here, my man. So maybe just by way of introduction, could you start off by just giving us a little background about yourself and maybe what was the inspiration or driving force behind the idea for LegUp Health and tackling the health insurance industry?
Absolutely. Well, I'm from North Carolina in the USA originally, and I went to school at Duke University, which is probably internationally known as for their basketball program. Mm-hmm. I dreamed of being a basketball player growing up, but I ended up wrestling there.
How tall are you?
What's that?
How tall are you?
How tall? I'll say I'm 6 feet, but I'm a little below that.
Okay.
But I ended up wrestling instead of basketball, and the stadium that the Duke basketball team plays in is Cameron, and it's sold out every night. Mm-hmm. And for the wrestling matches, it was completely empty. So totally different experience than what I had planned out. But after I graduated, I moved out to Utah. And I was planning to be a ski bum for a year. This was in 2007, so about 13 years ago. And when I moved out there, while I was a carpet cleaner in the mornings and a bellman at a hotel in the evenings, I met a founder of a company called Zane Benefits. Mm-hmm. And he, Paul was his name, Paul Pilzer. He's written a couple of books. I think one of his most famous ones is Why God Wants You to Be Rich. Mm-hmm. And I think it's actually a pretty common book that a lot of early entrepreneurs read. But anyway, he had started a company called Zane Benefits and raised $3 million in venture capital. Mm-hmm. And I was kind of a big fish in a small pond in that I stood out in the ski bum crowd in Park City, Utah, because I had a Duke undergraduate degree. And so he brought me on as one of the early employees. And a year later, things didn't go as planned. The venture capitalists ended up asking Paul to step down to CEO, mm-hmm. and I became the CEO of that company. Mm. And so for 10 years, I ran Zane Benefits. It's now actually called People Keep in Park City. And what we would do is we would let companies, like small businesses in the US, they have to offer health insurance to their employees in order to attract and retain them. But a lot of small businesses can't afford to do that. And so we gave them a way to give employees money, sort of like they give wages, mm-hmm. but designated for health insurance. Mm-hmm. And then the employees would use our software to basically get that money, sort of like a reimbursement account, mm-hmm. So that they could pay for their own individual health insurance coverage.
Awesome. Okay. So you have, I guess, an extensive background in health mm-hmm. insurance already. So that's a nice precursor for what you've gone into with LegUp Health. So how did LegUp Health come to birth then? Was there a transition period? Did you decide that you wanted to do something yourself, or was it kind of a natural evolution?
So People Keep was a venture-backed company, and it was somewhat unstable. And as a result, there was a challenge with the equity pool, mm-hmm. and so in order for that business to make sense, and this is relevant to any startup founder who's thinking about bringing on capital. When you get a lot of capital when you get a lot of different investors on the cap table that have given you money, it gets less and less motivating for you as an entrepreneur to keep going because you own less and less mm-hmm. of a percentage of the company. And because I wasn't the original founder of People Keep, I didn't have that. I didn't start at 100% and start giving it away. I started at 1% and got up to, let's just call it 10%. Mm-hmm. And so anyway, we couldn't work out a larger equity piece for me. So I was actually asked to resign. That's a nice way of saying I was fired. Mm-hmm. And this happened in 2018 after 10 years there. I had a 2-year non-compete with the business. So I took a year off actually to be sabbatical and forced myself to stay away from health insurance.
Okay, good idea.
And I came back after a year and I realized I couldn't do anything directly competitive with People Keep. But I remembered a huge problem that we experienced at People Keep, and that was when we had about 3,000 business customers mm-hmm. at People Keep, and each of them had about 10 employees. And so when they would hire, on average, turnover in a small business is about 20 to 40% per year, depending on the industry. But so on average, our clients would hire 3 new people a year. And when those 3 new people came onto the company and the company said, hey, yeah, we offer PeopleKeep, you get money to go buy your own health insurance, you could see the fear in the employee's face as they realized, I've never bought my own health insurance before, and this is going to be terrible. And it caused a lot of our customers to lose employees because, honestly, people would rather have a worse job sometimes and have health insurance taken care of in the US than have the job of their dreams. So at PeopleKeep, we didn't sell health insurance. We didn't help people with their health insurance. We were purely software. So LegUp Health, I started earlier this year to fill that gap. So when a company doesn't offer benefits, they can basically they can help their employees through LegUp Health get their own health insurance. And so it came from just experiencing and witnessing a problem over many, many years and sort of going, why isn't anyone solving this, and diving in from there.
Yeah. So from a customer standpoint then, is your typical ideal customer for LegUp Health the same as it was previously, in that you're helping the employee facilitate purchasing their health insurance, or are you partnering with other businesses in the same way, or are you going more direct to the consumer with the employee?
Great question. LegUp Health is focused on consumers. PeopleKeep was a business-to-business enterprise. And so our customer was the company that used our software to offer the benefit to the employees. We work directly with it could be a worker, it could be someone that's currently unemployed, but we consider our customer a household in that oftentimes, if you take a family of 4 or 5 people, there may be multiple health insurance policies that need to be set up, one for the wife, one for the husband, maybe some for the kids. And they all might be on different policies, for example. So the household is the client, is sort of like how we think about what our client is. When we say client, we mean household.
Awesome. Okay. So I know this is like, I actually lived in Canada for 2 years. So health insurance is like part of a lot of the companies there. And I think the States is obviously the same. It's not as familiar or similar in Ireland at the moment, but how much of a challenge is that, do you think, from the business perspective, or from like a board management perspective? Is there a lot of pressure to be like providing employees with those types of benefits now? And are people coming to expect it almost in terms of jobs?
Oh, in the US, the US is kind of weird. So it's, until recently, the majority of Americans got health insurance through their work. So it started back in World War II times when taxes in the US were extremely high due to wage and price controls to fund the war. And so what ended up happening is labor groups negotiated for unions the ability for those employees to get healthcare paid by the company without it being subject to like the huge tax rates that were subject there. And usually when stuff like that passes, it's a temporary measure, sort of like COVID today. There's a lot of stuff being temporarily removed, but once you remove it, it's really hard to go back after it. Go back afterwards and take it away. Once you give it, it's hard to take it away. So the exclusion for taxes for employer paid healthcare remained after the war. And that provided a huge incentive over the next 20 years, from the 1940s to the 1960s, for employers to be heavily involved in healthcare. So in the US, if you are older than, let's just say 30 or 40, your 30s and 40s, you don't know anything else other than employer provided health insurance. In your mind, a good job comes with health insurance. That's still that's still the primary way people think about health insurance in the US. But it's part of my hypothesis about this business is that if I look forward another 20 years, I believe that paradigm is going to shift to where most people think about getting health insurance on their own, either through the government or on a private market, directly from an insurance company versus through their employer. And that's my bet with LegUp Health.
Okay, that's interesting because that's kind of the model that operates here in Ireland at the moment, where most people would have a private health insurance provider and not have it provided through their employer. But um, I didn't realize that it actually went back so far in the States to like the 50s, 60s, like you were saying. So that's very interesting. I wasn't aware of that. With your experience in insurance and healthcare and software from your previous job, I guess I'm interested to hear how you think about technology changing the landscape in insurance, because I think insurance, like traditionally, I don't know, a lot of people might put it in with banking in terms of like a very traditional type of way of doing business. And I think technology has disrupted a lot of different industries over the past few decades. And I think you're probably at the forefront of seeing that crossover between technology and insurance. So I'm interested to hear how you think it's evolved maybe over the past decade or so. And then it seems like you're jumping on to a line of thinking that is going to help people get accessible healthcare through technology as kind of a medium as well.
Oh, absolutely. So on the tech, so sort of how I view technology in this space, it's a lot different than other industries, primarily because of the regulation.
Mm-hmm.
So what's kind of cool about let's just call it the B2B SaaS space is that the first areas that really got transformed by the internet and software as a service and just technology in general were less regulated in that you could go do things without worrying about whether or not someone would die or you would massively violate someone's privacy.
Yeah.
Health privacy. And in the US, I'm not sure how it is in Ireland, but in the US, personal medical privacy is one of the most like protected pieces of information
Mm-hmm.
in our country. And so if you're a provider, let's just say like LegUp Health, you have to be very careful when you're working with consumers, for example, about protecting and not leaking or oversharing anyone's medical information. And
Yeah.
so that combined with the fact that health, when you're dealing with healthcare, people might die and do die because of experimentation, because of a lot of different reasons. It makes regulations compound on top of each other over years, and we have a lot of regulation here in the U.S. that makes it very, very difficult for a startup founder to get something that has traction without running out of money first. So what I would say is there are opportunities with technology. However, it requires, I don't look at this as necessarily technically challenging from you think of like technical challenges as being things that engineers want to work on. With healthcare, at least on the consumer side of things, it's much more regulatory complexity. So it's a different type of problem solving than what most technologies are used to do. The logic isn't necessarily behind the scenes. It's in the tax law. It's in the the HIPAA or the health laws, and
Sure.
figuring out how to automate compliance with those while also doing something that's not simplifies something for the consumer.
Yeah.
So that's what we do basically is we identify what are the rules, and if the consumer on their own would have to go through 20 steps to comply, how can we reduce, how do we minimize the number of steps they have to take, but also make sure they understand what they're doing and stay compliant. And so a lot of our, think of it like an iceberg. What the consumer sees in healthcare is the tip, but there's all kinds of stuff going on underneath that is primarily happening from a compliance standpoint.
Yeah, absolutely. I guess that's where your industry knowledge comes in as the value proposition that LegUp Health has. Your, for want of a better phrase, your own intellectual property and the knowledge you've built up over the years is serving to be a condensed form of helping people to get access to healthcare where they may otherwise not have had the opportunity. So I think, would that be fair? Is that a fair assessment?
I think that's a good point. Like regulated industries are a double-edged sword. Once you understand, once you have the know-how of how to operate in them, it makes you much more comfortable navigating the risks. But there's two parts to that. One is it keeps competitors out, right? So it's a great competitive advantage to be in a regulated space when you have the know-how, but it's also risky from a standpoint of if the laws change, our product has to change.
Yeah.
Or maybe we go out of business, right? And so being able so that's kind of hits to another advantage is being able to live in the future a little bit because of the industry knowledge helps us tremendously in terms of knowing where to spend technology development resources on things that we think are going to be around a long time.
Awesome. Yeah, absolutely. So to jump back to the consumer perspective for a moment, what does that look like for them if they want to use LegUp Health? Like, what's a typical user journey or user flow? Like, how do they benefit from the service that you provide, I guess? And can you give us an example maybe, or
yeah, absolutely. Yeah. So I'll just give you a consumer example. So most entrepreneurs in the US that are early stage, they don't make enough money through their company to afford group health insurance or one plan for everyone. And so they end up going on their own to buy health insurance. And there's actually lots of, if you search online for startup health insurance or founder health insurance, you will discover a myriad of problems of like how people can't figure it out. So one of the reasons people in the US don't become entrepreneurs is actually health insurance. And the reason it's challenging is that, let's just say you start a company. You're used to getting health insurance through your job, but because health insurance in the US is very fragmented, meaning some people get health insurance through the government, some people get health insurance through their employer, some people get health insurance through private mechanism. If you don't know how to navigate those three areas and figure out what's best for you, it can be really challenging. And some people just decide to go uninsured as a result of it. So where we come in is we say, listen, we are a consumer agency, meaning think of us as a concierge service for you as a consumer that's going to help you figure out which one of these buckets you belong in. Is it an employer bucket? Is it a government bucket? Or is it a private consumer bucket? And so the journey is, you go to LegUp Health, you create an account. The first thing we're going to ask you is, what's your current health insurance situation? And you're going to say one of three things. I have health insurance and I want to keep it. I like it. I have health insurance and I actually need to replace it with something new because I'm losing it or because it really is terrible. Or three, and this is common, I'm uninsured and I need to get health insurance before my wife kills me, or my spouse kills me. And it's so you'll click one of those buttons, and then if you have health insurance, we're going to ask you to tell us about your health insurance information. And it's basically three questions. What's your policy? What kind of health insurance do you have? What's your ID number? Insurance cards have an ID number on them typically that the provider uses to look up the benefits, and upload a picture of your insurance card. Well, then this is where we leverage some technology where we verify the policy that they have currently. We basically can pull back what's the deductible on their health insurance plan. And if you're not familiar with the deductible, it's basically, when does the health insurance start paying for stuff? And then, what's their out-of-pocket maximum? What's their max exposure? And once we do that, we can say, hey, okay, based on, your situation, what you have now, here is a tool to go shop for health insurance if you need to replace it or shop for coverage, or let us become what's called your agent on your existing health insurance plan, and that way we can help you get more out of your health insurance and deal with the insurance companies when you have a problem.
Awesome. Okay, yeah. So you're really filling that gap for people who are struggling or don't maybe have the option, like you said, with being an entrepreneur or startup. And I think that's a very interesting example because it's probably not a necessary expense at the very early stages for any startup or business, or it's not maybe one of primary concern for a lot of people when you're trying to get your initial revenue going. So it's a very interesting market demographic as well. So can I ask a bit about your own growth so far with LegUp, and that maybe you can put your entrepreneurial hat on for a moment, but what's kind of been your approach to growth, I guess, with a kind of direct to consumer product, and what has worked maybe and what has not worked from
and I'm happy to be fully transparent with this stuff. So high level, we founded, the company was created in February. So that's 10 months old. We didn't launch the service until May. Between February and May of this year, I spent most of my time doing idea validation. I leveraged, I'm sure many of your people who might be watching this or listening to it have heard of the Mom Test, which is a book. I forget the author's name.
Yeah,
but
Rob Fitzpatrick, I think.
Rob Fitzpatrick. Yeah. That's exactly right. And the framework is great because it just reminds you of how simple it really is to determine if an idea is a good one before you spend tons of energy and money trying to deliver on that idea. So I was really disciplined about that between February and what I would call like end of April for 2 months. I did about 50 customer interviews with people who either were uninsured, startup founders who bought their own health insurance. And I discovered that there was a lot of pain. The common pain point was health insurance is a black box. I don't know if I have the right health insurance for me. And then I don't know how to get the most out of it when I need healthcare. I don't know how to use it. And so it became very clear how to do this. So we built the MVP. And actually, I didn't even build an MVP. I would say I built I have a podcast called Startup to Last, and my co-founder, my co-host, and I on Startup to Last came up with a term for me called the minimum sellable product. And so I built that and launched it in May 1st, and that was a Slack group of people who were willing to make me and LegUp Health their agent on their existing health insurance.
Awesome.
And so our first revenue came in May. Once we became the agent on, I think it was 7 of the customer interviews I did became clients, my first clients. And that became our first revenue for the company around a Slack channel.
Awesome. Yeah. Well, it just goes to show, I mean, obviously you were disciplined in doing all your idea validation, but there's no need oftentimes for a fancy, fully fledged developed website or web app or product before you actually go and start getting those initial customers. And I think I've learned that in the past as well, the hard way sometimes, that if you spend hours building something or weeks, months, it's not necessarily going to mean people are going to want to use it. So I think it's a great approach, and you're obviously being as efficient as possible and minimizing the opportunity cost associated with trying to launch something. So that's fascinating. Absolutely.
So once the Slack group was launched, and we got people around that, I took my foot off the gas pedal in terms of trying to find clients. And I just focused on my initial clients and building a software application around them. So from like May through, I'd say end of July, it was all no-code software development. So I leveraged Webflow, Zapier, MemberStack, some of the popular no-code tools to build a true MVP with software that allows someone to create an account online, add their insurance information, and start shopping for health insurance, all without talking to me. And then once, while I was doing that, people, I still had conversations with people. It was quite hard during a pandemic. One thing that was really challenging was I expected when I could start the company that I could just like go to networking events and hit 100 people with my interview questions.
Yeah.
Doing the idea validation was, and build, continuing to validate while I was building the product was really challenging because it was so hard to get. You had to like schedule a 15-minute call just to ask someone 3 quick questions, and so very difficult. But I got the platform built, and by then I had about, let's just call it 15 clients. So but they were everything was getting automated. And then the next challenge, and this is I think where a lot of people probably choose how to handle this. I was deciding whether I should speed up to customer acquisition or really nail what we were, because I was having trouble describing what we did to people.
Yeah.
And it's like, well, do I just go like hammer this and just go get clients and figure out how to explain it later? Or do I spend some time right now, figuring out how to actually position and message this thing? And so I actually spent some time going through Obviously Awesome, which is another book I'm terrible with author names, but great book. But it walks through a framework on how to position an early stage company or product. And that's when I accepted the fact that I was a health insurance agent. Despite, me wanting to deny that up until that point. And that took about 2 months. So figuring out how to position and messaging and testing things, that was a really, really long process, but I'm glad I did it because it allowed me. So in the US, health insurance gravitates towards the end of the year in terms of when people shop for it and change it. There's an annual open enrollment period that runs from November 1st to December 15th that literally ended 2 days ago.
Okay.
So my metric, so we didn't do a ton of marketing. Most of this was just, what I would call relationship marketing, meaning I reached out to my network and asked them, who could I talk to and learn from about buying their own health insurance. And I've got the stats up on my little whiteboard dashboard to the left here, but we ended open enrollment we're at 95 users now. 40 of those are clients, meaning they've made us the agent on their health insurance. And then we also, had a bunch of, we had 3 companies this year decide that they wanted to offer LegUp Health as a benefit to their employees. Oh, awesome. And so we have 3 B2B customers under a new brand now called LegUp Benefits. Fantastic. And so that translates into roughly, to start January 2021. So January 2020 was $0 MRR. We weren't even a company. Our monthly recurring revenue. We'll start January 2021 with a base of about $2,000 to $3,000 in monthly recurring revenue.
Awesome. It's funny that you mentioned your clients who are offering LegUp Health as a benefit, because we actually wrote an article this week with Startup Sanctuary about the B2B2C model of doing business. And like you said, yes, you are a B2C style business, but you're opening up those other avenues by approaching other businesses who have pools of clients that they can offer you as a benefit for. So it's funny because we literally wrote about that this week, and you're a perfect example of someone who's doing it in practice.
It's cool. It was, my last business didn't have legs. And what I mean by legs, it didn't walk by itself to other people. And this thing has legs. And that's why I'm probably most excited about it. Even though the revenue numbers aren't that big yet, and really not big at all, it's growing by itself. And so take that B to B2C concept. Mine's a little different in that it's B2C to B. In that, and then 2C again. So it's got that kind of expansion, consumer expands to business, expands to more consumers. And it's so cool because I didn't market to any of the customers, the business customers we got. We were brought in by a consumer client. So, one of their employees, found LegUp Health through a friend or, through a relationship, in my network. They signed up, they said, "This is great. I work with 9 other people that have this exact same problem as me." And wouldn't it be great if my company gave me money too on top of this? Will you build something for that? And 3 months later, we have LegUp Benefits, which lets the company offer money to each employee as a benefit, in addition to offering our services, and that's another revenue stream now, in addition to a lead generator.
Yeah, and you've got the ball rolling, so you're all set for 2021.
Well, yeah, different, all set with the problems that we saw for 2020, ready to face a new set of problems for 2021.
Absolutely. So I have to ask, Rick, do you see any kind of macro trends in the insurance / health / technology industry at the moment that you kind of see going on from your bird's eye view? And are you kind of trying to capitalize on any of those macro trends with what you're doing at LegUp Health?
Absolutely. So there are 2 major ones that I focus on. One is, it is just the consumerization of everything. And so health insurance hasn't quite happened with health insurance in the US as quickly as other things, like say the iPhone. But if you look at, for example, the history of, if you look at health insurance over the last 20 years, it's a snail's pace compared to other things. But in the early 2000s, individual health insurance, the number of people buying into their own health insurance started to grow. And it's been growing for 20 years. And you probably heard in the outside the US about this thing called Obamacare. Mm-hmm. That was a big deal in the US. That all the Obamacare did was the reason it got passed was it recognized that there's this macro trend of people shifting from employers mm-hmm. to buying their own health insurance. Sure. And Obamacare, what it did was it shored up protections and created a more stable / reliable individual health insurance market mm-hmm. to be ready for the next phase of growth.
Okay.
And so that trend from employer health insurance to individual health insurance is a huge macro one. The second one is, and this has been accelerated dramatically by COVID, and it's the digital health. It's digital health. So digitizing the experience, the doctor experience, and everything sort of in that realm, where people no longer need to travel across town to go see the doctor. They can pull up from a consumer standpoint, they can pull up their phone and go see a doctor on their phone. Those two things present a lot of opportunity for LegUp Health because the consumer is driving is driving how they want to consume the health insurance in this case, but also basic medical services. And so there's some opportunities for LegUp Health to add a lot of value there.
Awesome. Yeah, it sounds, having worked in technology, I can appreciate the way in which technology has evolved. And I think, I don't know, maybe I'm coming into it with a bit of a bias, but it would seem like insurance and some other industries are a bit slower on that trend. But I'm only guessing that's because they're so large and so well established already that bureaucracy, red tape and stuff requires them to, take a little bit of time to catch up. But it seems like it's getting there. Yeah.
Yeah. And it's regulation too. Part of this, people don't realize this, but before COVID, Medicare is the government program that covers the elderly on health insurance in the US. So mm-hmm. once you're 65 in the United States, the government pays for your healthcare through Medicare. It's not free, but it's very low cost for a consumer. Before COVID, they had rules against you being able to see a doctor virtually.
Okay.
So if you were over 65, you had to with your broken leg and your broken back and your wheelchair, you had to wheel yourself to a hospital. Yeah. Makes no sense.
Yeah, it's crazy.
That's why this is one take on COVID. This is another thing we've covered at Startup to Last. It's sometimes you need these massive, nasty events or just things that happen that you have to deal with to break through a lot of this regulation, because as soon as COVID passed, Medicare said, oh, you can do telemedicine now. Mm-hmm. And now all these old people are able to see a doctor without leaving their homes, and it's not going away. And so COVID, it's been terrible. I don't mean to downplay, it is a terrible thing for the vast majority of people today, but long term, and especially in the healthcare space, COVID's going to do some really good things because it accelerated a lot of these trends that were being held up by regulation. So I'm grateful from that perspective for what COVID's done.
Yeah, it's a great point as well. I think a lot of people will benefit from that in the long run. Like you said, like speeding up. Obviously, we can't downplay the situation, but you're absolutely right. It's forced people to come up with new ways of doing things. I think most people have had to become more creative in how we've approached work and daily work. And I think healthcare professionals in particular were the first line of defense impacted in that way. So absolutely. Yeah. So Rick, you've gone from, I guess, being CEO of a company for best part of a decade, I think, and then moving to a journey of building something yourself from the ground up. How do you compare both of those experiences, and what is it that you love most about what you're doing now?
Yeah, so that's a great question. First question was, how do I compare them? They're totally different. And I didn't realize it. So part of the reason I left PeopleKeep or was asked to leave PeopleKeep was because I wanted to be treated and paid like a founder.
Yeah.
And I felt like I was one over the 10 years.
Sure.
Now that I'm actually a founder and I'm starting from nothing, I understand that I was pretty naive in terms of I went in there and there were systems built, the product was built, it was validated. And yeah, I grew that to a reasonable, like real business. But the stage before that, it is really, really hard. And people don't realize this until you go do it. It's really, really hard to take something from an idea to generating meaning, like real revenue, and having some semblance of this has real potential. And I didn't have to do that at the last company. I kind of picked it up having that been done, which makes me really, in a good way, that makes me really excited about the future of LegUp Health, because I've done this next step before. I what I did this year, I'd never done before. And it was really way harder than I thought. The other thing that's really different is when you own 100% of something versus 10% of something, the urgency in which you operate it's totally different. In some ways, you operate more urgently on a day-to-day basis, meaning you got to get this done because you got to pay yourself, or you got to make money, or something like that. But there's also this less urgent thing I'm not so quick to give up equity. When I'm, if I can wait one more month before hiring someone, I'm much more incentivized to do that in this realm. I just feel like I can take more of my own time, I guess, because I don't have investors, and I can sort of control my own destiny. And I really like that about this. Whereas at PeopleKeep, there were 45, 50 investors on the capital table, a board, a lot of expectations and a lot of urgency. And so I find the ability to sort of drive this business however I want to drive it to be the most fulfilling and probably best thing, like what I love best about it.
Yeah, I don't have I worked in tech consulting for 5 years. I definitely wasn't running any business or anything like that, but I like the analogy you drew, because it's a completely different ball game when you're coming into a business that is set up with systems and processes and ways of doing things, and even from a tech standpoint as well. And then we're on the journey of trying to build Startup Sanctuary, and it's a lot of work. Yeah, absolutely. It's a lot of fun as well, but it's a huge amount of work to just figure out exactly what you should be doing, when you should be doing it, and prioritizing a lot of that. And yes, it is freedom in one sense, but there's a lot of work that goes hand in hand with it. But I like how you said, like, you get to shape your own destiny. So I think that's the overarching thing that I took away from what you said there. And I think it's a great goal to have.
Totally.
So what's next on the agenda for LegUp Health? Let's say 3 to 6 months, or even for 2021, the outlook. What's on the agenda, and what's coming into focus for you guys next?
That's a good question. So it's a very seasonal business, meaning we're probably, if you look at like capacity of hours worked and that is reactive versus proactive, it's 80 to 90% is going to happen during that open enrollment period from November 1st to December 15th. So I'm not at the highest level, what I'm trying to decide between, I really haven't thought about this yet, but I need to, for 2021, it's do I focus 100% on LegUp Health and LegUp benefits in 2021? Or do I say, this thing's seasonal, I need to go work on another project, and maybe use that money to hire people to do LegUp Health stuff. So I'm still, do I just dive in and go after this as hard as I can? I'm leaning towards that one, just focus on LegUp Health and go. And let's just assume that I do that for purposes of this conversation. What are the top priorities for 2021? One is there's automation. When you build an MVP, you oftentimes make it look to the customer like everything's automated, but behind the scenes, it's you're doing you are the machine. And so there's a couple of those things that I need to figure out how to address and remove me from, whether that's hiring someone part-time to do the manual process on my behalf, or automating with technology. That's one bucket of things. Another is what I would call fleshing out LegUp benefits in terms of both a product and a brand. What is it? And what we're charging money for, we charge $20 per employee per month for it. What exactly is our value proposition? That's a bucket, but I really, that falls under a bigger bucket, which is how do we distribute LegUp Health? How do we grow it? That is, I think we've learned three things. One is this thing has legs, meaning there's natural word of mouth. So we're going to grow every month without having to do much, which is great. We believe that organic search engine optimization is going to be a huge opportunity for us. We've already got some traction there. And then third, we're trying to decide between, is it outreach, to consumers that's our best ticket, or is it going indirectly through referral partners to get to consumers as a third leg of the stool. And then fourth, then the next bucket is, and this is probably the thing that I'm most worried about in 2021 in terms of the business model working. How do I hire people to fulfill, if we did 100 users this open enrollment period with no marketing, when we're, if I fast forward to next open enrollment period and we've got 1,000 people potentially that need help, how do I staff for that?
Yeah.
How do I, make sure that they maintain the quality that I was able to provide, this open enrollment period? That's probably the thing I'm most concerned about, but I'm trying not to worry about that too much before I figure out the other things.
Yeah. Yeah. And that's another great point. And it's probably a good problem to have in many respects, but again, it's something we actually wrote about recently as well. It's like, how do you put the structures in place to handle the scaling once it actually happens? And thinking about that before it happens is sometimes tricky, and it's hard to anticipate what exactly is going to happen. But I guess that's part of the process of trying to build a business, and trying to figure out what should I be prioritizing. But hopefully for you, that will be a good problem that you have to solve in the near future with a nice influx of customers, with everything that you're doing. So look, Rick, thank you very much for jumping on and joining. If people want to find out more about you and LegUp Health, they can visit leguphealth.com. Is there anything else you'd like to part with before we finish up?
Yeah. Just if you want to talk health insurance, LegUp Health is the way to go. I also have a podcast at startuptolast.com. So if you're interested in building companies without raising venture capital, that's what we talk about. So awesome. We love to hear from listeners. And then I have a newsletter at ricklindquist.com that you can subscribe to. And that's all about just how to be a better person. And feel free to reach out to me directly anytime. I love hearing from people and talking about problems.
Awesome. Absolutely. You've got plenty to keep you busy, and I'm sure people can find a lot of value in it. So once again, Rick, thanks for joining, and best of luck with everything going forward.
Thanks, Gordon.
Cheers.